Good morning, everybody, and welcome to this Ofsted training webinar. Thank you for your patience. We had a few technical issues this morning, and so we needed to start a few minutes late. Thank you very much for joining us. My name is Lucia Wild, and I am the Director of People at Ofsted. And I'd like to start with an outline of this morning and then some domestics and logistics. So first of all, an outline of the morning. In a moment, I'm going to pass to His Majesty's Chief Inspector, Sir Martyn Oliver. We're then going to hear from our National Director for Education, Lee Owston, and our National Director for Regulation and Social Care, Yvette Stanley. We'll then take a 15-minute break, and after the break, we'll have a presentation by Simon Blake, the Chief Executive of Mental Health First Aid England. And our final speaker of the morning will be Andrew Cook, our Deputy Chief Operating Officer for Delivery, our Regional Director for the West Midlands, and our Senior Wellbeing Champion. Could we go to the next slide, please? So now some logistics. So first, on the recording of the training webinar, I want to let you know that we are recording the training and it will be uploaded onto the Ofsted YouTube channel. This is a public channel where anyone who wants to watch it will be able to. And second, on attendance, please log your attendance at this webinar on LearnSpace and do the same if you're watching this webinar after today. And details of how to do this will be sent to you after the webinar. Third, on technology. Because of the number of people dialing in today, cameras, mics and chat will not be available, and please avoid using the raise hand function because of the number of people on the call. And fourth, questions or queries. If after today you do have some questions, there will be opportunities for reflection through structured discussion within each region in the coming weeks. So please make a note of anything you want to raise at these. And that concludes the logistics. And so now I'd like to hand over to Sir Martyn Oliver, the Chief Inspector. Sir Martyn.
Thank you, Lucia, and Happy New Year to everyone. I know we've had these technical difficulties this morning, and I'm very sorry about that, but there's a very large volume of people who are on this call, and it is being recorded, and everyone will be able to watch it if they've not been able to join at the very start. So I want to thank everyone for attending today, especially at short notice, and especially for what is for many of you the start of a new term. But I'm delighted that I'm able to talk to you today, and I look forward to meeting and working with you all over the next 5 years. I hope to get out and visit all 8 regions across England that Ofsted works across and speak to staff and as many providers and come out on inspections with each of you over these next 5 years. But let me just begin by thanking you all for the really vital and important work that you all do. I've been really impressed, very impressed by the experience and expertise I've seen so far, but I want to recognise that we are working in challenging times. The sectors are working in challenging times. We are working in challenging times. And we do difficult work, but that is difficult work for the sake of children and learners. And you, the inspectors and regulators, you do a vital job in ensuring that children are properly cared for and can make the very most out of their crucial time in education. So I knew I needed to get off to the fastest start possible, and hence this training today. But I know that we need to keep going. There is more, much more that I need to do, that we need to do. But I also know that I need to manage change in a way which is considerate to your workload as inspectors and regulators and the workload of the staff in the settings which we work across. So again, thank you for being here today. Now, this introductory session is for you, but it will also be made public, as Lucia's just said. I make a commitment now to be as transparent as we can be, being aware, obviously, of personal data, commercially sensitive material, etc. Today's session, which introduces the expert training we will all receive from Mental Health First Aid England, is led by Simon Blake, their Chief Executive, and I'm very grateful to Simon for doing this work and for leading it himself. The further training sessions are the property of Mental Health First Aid England and are not publicly available because it is their commercial property. Now, let me state right now that whilst this training is guidance on how we act and how we recognise when those we inspect and regulate are under stress, I know that we must not stop there. We will look at your workload when inspecting and regulating, and we will look at the workload of those that we inspect as we work together to build a modern and fit for purpose inspectorate and regulator. I must consider the root causes of stress and consider what those root causes are and what more we can do to minimize those stresses whilst carrying out our crucial work. I understand this. In all my time in education and leadership, the very vast majority of people that I've worked with, they recognise that they are accountable and that they should be held to account. But it is how we go about doing this proportionately that I am keen to focus on during my time as His Majesty's Chief Inspector. This training then is not the beginning and nor is it the end. We've already done much in the last 12 months, but we can and must do more, much more going forward. So this is the start of week 2 of being the Chief Inspector for me. And I just want to take a moment to thank those of you that have spoken to me in the months prior to starting the job, the many of you on this call that I know by name, and to all of the team here at Ofsted who've helped me in the inductions and handovers to get off to the fastest start possible. It feels like I've been in the role much longer than the 5 days already, but in a really good way. I've had really busy meetings and busy work in the last 4 days since we started on the 2nd of January, and I'm delighted that Professor Julia Waters, Ruth Perry's sister, and her colleagues came to meet me, and then I also met with the school leadership trade unions, ASCL and NAHT, and the representative of trusts, CST, in my first 4 days. But I will be reaching out to all representative bodies and individuals going forward. Now, just a fraction, a tiny bit about me, just to introduce myself as Chief Inspector to all of you. Many of you who know me know that I've been in education for 28 years. It's rather fortunate that 14 of those years were working in local authority maintained schools and 14 years in the trust. It seems like a moment to reflect upon the fact that I've spent equal amounts of time in both types of settings in schools. And I've been on the receiving end of 99 inspections myself, 96 I've physically attended, so I have a deep understanding and sense of that. But I also recognise that challenge is from a school setting. And so I've been working hard to understand the early years, the further education and the social and children's services settings, and make sure that I get up to speed in those, and I'll be prioritising that in the first weeks and months. Now, I realised that there'd be a challenge over the next 5 years. I know it's a crucial time for Ofsted and for the sectors, and the work will be hard. But that's why I've chosen to come. I've chosen to take on these challenges and to deliver for you, the workforce, for children, most importantly, and learners, and for parents and for the staff we inspect and regulate, the very best system that we can make together. I am passionate about raising standards and improving lives, especially for the most disadvantaged and the vulnerable. We will be talking about disadvantaged and vulnerable children far more going forward. All that we do has to be for and on behalf of children and learners. On application for the post, what struck me most was Ofsted's unique position. Why unique? Well, because Ofsted is the only organisation that inspects, regulates and reports on every aspect of a child's or student's education or care. I passionately believe, therefore, that Ofsted must play a full and active role in supporting the system to build resilience, and we absolutely must not be seen to undermine that resilience in any way. So, the importance of Ofsted, it's a passion that's for the vulnerable and disadvantaged that's driven me to apply for the role. As I said, I recognise it's a crucial job, and that we're absolutely right that we inspect schools and inspect children's care, early years, further education and children's services, and it's vital. I think we're really interested in 3 main things in that work. We're interested in keeping children and learners safe and making sure that our sectors are doing that. We're interested in raising standards and improving lives through the reporting and regulation of the system directly as the regulator, or in the case of inspecting, acting on behalf of the regulator, which is the Department for Education. We've said this many times, but it needs to keep being said. Nothing should be done for Ofsted. Everything providers do should place the needs of their children, learners, students first. Through the EIF, Ofsted just checks that providers have been clear in their intent, that the implementation is of high quality, and that in doing so, standards are raised and lives are improved. The impact. Across our social care frameworks, we're looking at the experiences and progress made by children. There must be, as we would all agree, be a positive impact of the work of leaders, a positive impact on the standards of education and protection and care. Outcomes matter. Great outcomes, whether they be outcomes of attainment, health, or social skills, help children progress on to positive next steps. They especially help the most disadvantaged and vulnerable. There must be a positive impact on safeguarding. All of us, staff and children, need to be safe, happy, healthy and secure to flourish. The culture we create and the culture of the providers we inspect is of the utmost importance. Children and their parents rely on Ofsted to independently check providers against those standards, and where we are the regulator to take compliance and enforcement action, and that is our most vital work. Now, just want to take a moment to recognise the tragic loss of Ruth Perry, the devastating impact that has on her community and her family. But we must be aware then that there is an impact on those that we inspect and regulate. As you will all know, it was exactly 1 year ago today that Ruth Perry tragically took her own life. And I know that all of you, like me, were deeply shocked and saddened and affected by the news. And as today is the anniversary of Ruth's tragic death, I hope you will join me now as I call upon us to just mark that as a matter of respect, a 1 minute silence to reflect on this moment. So I will just have a 1 minute silence, please, before we continue. Thank you, everyone, very much for marking that moment. And as I said, my thoughts remain with Ruth's family. Ruth's tragic death triggered a national discussion and a lot of internal reflection about how we operate. It's part of the reason that we're all here today. And it's already driven several changes, including a quicker return to schools graded inadequate only on safeguarding, a consultation and now significant changes to our complaint system across all of our work, a duty helpline for providers during inspection and regulation activity, changes and clarifications to our safeguarding guidance for schools, more and clearer information for schools on the inspection timings, sharing outcomes, who can attend inspection discussions, how we evaluate attendance and behaviour. You're going to hear more about this from Lee and Yvette shortly, and more, much more, in the coming weeks and months. This, as I said at the top, is just the beginning. It is not the end. There is much more that we need to do. Improvement isn't something you do once and move on, it's constant. We all know this as serving practitioners and leaders in our settings. The next step for us will be our full response to the coroner's findings in the Regulation 28 report. That response will be submitted on the 19th of January ahead of starting routine inspections back for all on Monday the 22nd of January. Thank you again for those who have had their schedules changed last minute. I'm sorry that there was little I could do before I started in the role, but I simply could not announce until I began about those pauses. We are asking the coroner if we can make and publish our response to them, to everyone at the same time, and we hope to do that straight after submission if the coroner gives us permission. We want to build on the work that we've already done and I've outlined prior to the inquest and the work that we did immediately after the inquest. And along with those immediate responses, we will also consider and consult upon further responses going forward. We must make sure that inspection and regulation is done with providers and not to them. In all of those inspections that I had, they were the best inspections, and the vast majority were done very well, were always done with and not done to me. Now, you may have heard me talk about the big listen, and this is where I want to listen to all sectors and hear directly from parents and professionals. But because I don't think that anyone should want the thoughts of a single chief inspector dominating the sectors we work in. And that big listen will listen to you. You are the experts who are delivering inspection and regulation on the ground, and that is crucial that we hear from you about the best way forward, that we co-construct together. For those who say that we must not be captured by the sectors or the trade unions as we listen to them and work with them, I say to them, yes, we must be careful to put the needs of children and learners first. But I don't start from the position of thinking that those staff and those trade unions also do not want to put the needs of children and learners first too. After all, the sectors are the ones who deliver for children and learners. There should be no arguments of duality or elimination of one or the other, but it should be about building a synthesis. We all want the same thing, to help children and learners thrive. For those of you working in the settings and services now, you know, and I know, that it's a very difficult time for very many. There are multiple factors that are putting pressures on children, families and on staff. We must recognise this when we're inspecting and regulating. I see these factors as the negative legacies of COVID-19, the impact of inflation and the cost of living and the pressures that places on both individuals and providers, the impact on children, students and staff health, physical, social, emotional and mental health, the impact on attendance, which for some particular groups is shockingly low, and the impact of poor behaviour, as some are finding a combination of the challenges above that have caused significant dysregulation of their social skills. And then the recruitment and retention of all staff, teachers, lecturers, social workers, support staff, children's social services teams, etc., is incredibly difficult for many at the moment. And of course, how well all of those services that surround and support children and families in education and care are working together as civic institutions for the good of all. We're part of our sectors, we're not above them or apart from them, which is why I've also talked about Ofsted should be of the system, by the system, and for children and their parents. And of the system means drawing serving practitioners, as well as recently left non-serving practitioners and His Majesty's inspectors, and then working with those sectors going forward in a way which is deeper and more meaningful than ever before. Because it's not about us, it is about them. We're all in it for the right reasons, inspectors and providers. We all want the best, as I've said, for children, and the great education and their care is vital. Inspection is important and needed. Our ultimate duty is to children and to the older learners that we work across. But it also needs to be helpful to those we inspect and regulate, so we can be a force for improvement. Now, this is a clear message for those who get confused. Our work is protected and we have a duty to carry it out as enshrined in the Education and Inspections Act 2006. For those who call upon me to pause inspections for longer or call for me to abolish the single word grade, they misunderstand our role in working to the government of the day. Inspecting and regulating is a demanding role, and I'm very grateful to all of you on this corps who carry it out, which is why we want the very best people to take on this duty. I will have much more to say on this at a later time. In carrying out this work with professionalism, empathy, courtesy and respect, that is paramount. These are not soft skills. Working collaboratively is crucial. Done with and not done to, remember. Imagine that, I think it's as difficult and as easy as this. Simply imagine when carrying out your work for us that you're inspecting or regulating yourself. How would you want it to feel? What would you want it to look like? Part of that means minimising the impact we have on teachers, social workers, care staff, childminders, nursery staff, trainers and everyone else we inspect and regulate. I know that the frameworks demand a lot of you, and in turn it is difficult to not pass this pressure on. This is why we will look at this as part of the big listen, and I will listen to you, the experts on the ground. Inspection and regulation is our core business. I want us to focus entirely on this and place as much of our resource as possible on our frontline activity only. We must be realistic, however, that inspection can probably never be entirely comfortable. For any form of scrutiny to have value, it must have challenge. But that challenge needs to be tempered by care and understanding that I know you all deeply are passionate about. Because causing any additional stress doesn't help the provider, it doesn't help their children, and it doesn't help us build an accurate picture. We can always tell providers not to prepare or do anything differently because we want to see what it's really like on a regular day. But that should also extend to the staff. We want to see them as they usually are too. I know that the preparation for the days of inspection causes a lot of difficulties for staff, and they are some of the things that I want to change and I want to look at, and I want to see what more we can do to make that better going forward. So I do want us to focus on well-being and well-being for all. Well-being for children, learners, providers, and you, the inspectors. Your well-being matters too. And everyone's well-being is best served by inspection and regulatory visits that are carried out, as I've said, with professionalism, empathy, courtesy and respect. So next steps. Starting today then with this training for inspectors for you on mental health awareness, recognising that beyond this training I must look at the root causes of the pressures and stresses that people feel when inspection occurs. As you know, I've delayed the restart of the routine inspections to allow for this, followed by the training over the next few months for all inspectors, and the rollout starts this afternoon, delivered by Simon at Mental Health First Aid England. Ofsted inspectors, you'll be receiving invitations shortly, the week commencing the 15th of January. Please sign up to one of these sessions as a priority. Social care inspectors have mental health training as a key strand of their annual conference, which I'll be talking at later this week. Mental health awareness is also to be embedded in our induction training for all inspectors and our recruitment of inspectors going forward. It isn't a one-off, and it's not just about the training or just about being nicer. This training will also be a constant in how we go about all of our work and the culture we create going forward. I want to be genuine. Lasting change in how we operate and work with our sectors is what really matters. So there will be much more to come in the following weeks, months and years. The big listen is the vehicle for this, and it will be guided by listening to and engaging with our sectors and listening to you. As I've said, it is your expertise and experience of carrying out inspection that is vital. And we must make sure, though, that you also have the confidence to do your vital job, including taking tough but necessary decisions from time to time. I also want you to know that if you carry out your duty with professionalism, courtesy, empathy and respect, that we have your back. I have your back. So thank you. Thank you for taking part in this session, for the future training to come, and engaging so positively in the changes so far. And thank you for the resilience and professionalism that you have shown as we're going through this difficult period. I'm now going to hand over to Lee Owston, who is our new National Director for Education. You may know him from his previous role as the Deputy Director and acting as the National Director at times last year for us. He was my first appointment as Chief Inspector, and I know he shares my passion and excitement for what we can achieve together over the next few years. He's then going to say a few words and lead us into today's training, followed by Yvette Stanley, our National Director for Early Years Regulation and Social Care, who will talk about those remits and will take us into our break. So thank you again for joining us. I hope that these sessions are vital and that you play a great role going forward in how we conduct our Big Listen to improve our inspection and regulation activity. Thank you.
Thank you, Martin, and good morning, everybody. Happy New Year. I hope you all managed some rest and relaxation over the last few weeks. And I'm delighted to have started as Ofsted's National Director, although for education. Although, as Martin has said, I'm not new to Ofsted. So my role is responsible for shaping our inspection policies and guidance and what these mean in practice across all of our remits that use the Education Inspection Framework, plus initial teacher education, our teacher development inspections, and of course, alongside Yvette Stanley, our National Director for Regulation and Social Care, who will meet a little bit later on, area send inspections too. Some of you will obviously know me already, but I'm looking forward to working with more of you as the weeks and months progress. And if you don't know me, if I'm somebody new and a new face, then I'm proud to have been one of His Majesty's inspectors for nearly 11 years. And actually, like you, I was also an Ofsted inspector, or an additional inspector as it was known then, as a serving practitioner. So I've been a senior leader in schools. I've been a senior advisor in a local authority responsible for early years and primary. And I've also had some national roles, whether that's around national curriculum tests or national policy around early years and primary English. So like all of you, and like Martin, whether I've been working locally, regionally or nationally, I've been striving for the absolute best for children and young people. That's been at the heart of all of the roles that I've had. And actually, my job in Ofsted is no different. But what is perhaps different, and I'm acutely aware of it, is the uniquely privileged role that I have, not only as an inspector, as His Majesty's inspector, but as the National Director Education. And I think with that privilege, we need to think very carefully about the impact and influence that not only I have, but we have as a workforce. So let's just take a moment to think about the impact and influence that we have through our day-to-day work in the providers that we inspect and regulate. And I want to start by saying I haven't met an inspector yet who didn't understand, like I've just outlined, the absolute privilege of the role, and didn't understand the influence that we have on individuals, the communities in which they work, and the system as a whole. And that ordering is important. Individuals within their communities for the system as a whole, because actually it's our day-to-day interactions with those individuals that allow us to build those useful insights that Martin was talking about. And everyone joins Ofsted because they're passionate about children and young people. Therefore, we need to take that huge responsibility seriously. And as Martin said, we're all in it for the right reasons. So I don't want anybody to take what I'm saying today as a flippant response. This is genuinely about wanting to be better at what we do. And we should never lose sight of why we all do what we do. But, and I've been there, we do have a difficult job as inspectors. I know I've made those difficult judgments myself. I've driven away from inspections, always thinking through whether what I've said, what I've done has been in the best interests of the children and young people in the institution that I've just been in. And that's a human reaction. All of us want to do what is absolutely right. And therefore we constantly reflect on how we go about our work and what other people perceive about the work that we do. Because actually children and young people, really deserve the absolute best. They deserve the highest quality of education and care so that improvement can happen as quickly as possible. But where we receive criticism, we do absolutely need to listen, reflect, and act. Just as we expect the provision that we inspect to continually improve, then so should Ofsted, so should we. We're not beyond reproach. And in thinking through what I was going to say today, it dawned on me that there are two fundamental things about being an inspector. I want to kind of describe it as Well, it's an insatiable curiosity, isn't it? Born out of our expertise and experience. Are children and young people in this setting getting the highest quality of education and care they deserve? But alongside that expertise and experience and the technical knowledge that we all gather in terms of applying our various frameworks, we also need an exceptional bedside manner. We cannot lose sight of both what we do and how we do it. And actually, the latter is even more important than the first, because we must be conscious of how we're being perceived. Now, before I move on to some of the detail, I just want to dovetail with what Martyn was saying about this being the start, and actually within a much broader programme of training that we've already undertaken. We are resetting and we are moving forward in terms of what else is to come. So we're going to unpick some of this today, including with our specialist, Simon, from Mental Health First Aid England, later this afternoon, but also in terms of all of the other programmes that are underway in your various remits, including the national conferences this term. So let's just think about our behaviours and the code of conduct for a moment. As I said a moment ago, our words, expressions and body language all convey a message, and they can influence how others respond to us. Because remember, we're essentially strangers in somebody's already established working environment, whether that's a childminder's home, a nursery, a school, a children's home, a college, an apprenticeship provider. I could go on. People will be looking out for the signs of what we think as people who are in a privileged position. And that's completely normal, because we all look out for the signals from others in our daily lives to help that inner monologue that we all have in our heads about, I wonder what they think, I wonder how things are going. And this is even more important on inspection. You know, a scenario where there is inevitably an imbalance in the power dynamic because one group of people are evaluating the work of another group of people. And I don't underestimate for a second that that comes with anxiety from the start. But we should do all we can on inspection to ensure that our words and actions do not unduly influence the way people behave and interact with us. And that's a big ask, because we want everyone to perform at their best, inspectors and those we're inspecting. So whatever judgment we reach, colleagues feel that they've contributed and we've inspected with them and not inspected them or done to them. That means we need to be especially conscious of the ways in which we communicate so that we can work respectfully and professionally. So over the next few slides, I want to remind us all of our behaviours and code of conduct. And those of you that work with us for quite a bit of time will remember that we've refreshed our code of conduct about 12 to 18 months ago. But if we need to look again at the principles of how we conduct inspection, then of course it's important that we do so. Considering our behaviours and reminding ourselves of the code of conduct will help us to prevent undue anxiety and minimise stress during inspection or regulatory activity to the best of our ability. So let's take a closer look at some aspects of our behaviours and conduct which contribute to us being able to carry out our work with professionalism, courtesy, empathy and respect. And the first watchword, if you like, is empathy. I've mentioned this before, but just a few moments ago, but it's important to remember that inspection and regulatory work is a human process. It involves people. On both sides of the table, we are people who have heavily invested in the work that we do. And even where our judgments are overwhelmingly positive, the process of us gathering evidence and coming to those judgments can be and is stressful for leaders. And these are people whose day-to-day work is already challenging and stressful in the system environments that they're working, not to mention anything that may be in any of our personal lives that are affecting how we behave, how we think, and how we respond on a day-to-day basis. So whenever we are working with leaders, we should assume that they are likely to experience stress across the course of an inspection and do what we can to minimise it. And this is an important part of our work on every inspection. We should also understand the specific context of each setting provider, because there are other pressures on leaders that will help us to understand why they are pursuing particular courses of action and perhaps why they're behaving in the way that they are in terms of the on-site activity. So are there any particular pressures or challenges which leaders in the school or a nursery or a children's home or wherever else we might be inspecting and regulating that they're facing that we need to know about? How are individuals managing the stress of inspection? We might have worked with leaders, I know I have, who can become quite confrontational when we're faced with challenging judgments. And while we should expect professionalism from everyone we work with, we also need to recognise that that can actually be a sign of stress in itself, and we should try and listen and understand what leaders are saying. We also need to reflect on whether it's our own behaviours that have led to such a reaction. And in other contexts, we might want to work with leaders who become resigned or withdrawn when they hear challenging messages. We might identify that the leaders only heard the negative aspects of what we've said. Again, a typical human trait, and missed the positives, often the many positives that we would have shared. And so we need to be careful to communicate these clearly and make sure that leaders have got a clear sense of the overall picture which is emerging, both the strengths and the weaknesses. And remember, most importantly, we are working with people, and inspection is a human interaction. And we are human too. Inspection and regulatory work is challenging and can cause stress for ourselves as we carry it out. And in stressful situations, we might also have patterns of behaviour which are less helpful. So, for example, we might become less receptive ourselves to what people are saying back to us. But just being aware of these behaviours can be really powerful and help us to get better at managing them. And at the same time, every one of us, every inspector is different. There isn't one specific way to be a great inspector. As long as we're courteous, respectful and clear in our communication, we can and should continue to be ourselves and be human in the way we conduct ourselves and communicate. Which brings me on to our general manner. All of the previous points that I've mentioned can be wrapped up in general manner. I mean, how we come across, as I've said, is crucial from the start. From that very first interaction, normally via a phone call with the provider. We might have particular aspects of how we come across on inspection, such as our body language, that we can reflect upon and improve. But I'm very aware that we cannot self-analyse every single moment of our day-to-day work. It's a task, isn't it, to be thinking as an inspector in your head about what you are hearing, being able to record that, while also thinking ahead in terms of the questions you might want to ask, and therefore how you're presenting will be just part of the considerations we make as we move through an inspection or a regulatory activity. However, if we set out on every inspection to be personable and clear and keep in mind the challenges and stresses which leaders face, including from our very presence, then this will come across in our general manner. Now, there can be a view, because I've heard it just as much as anybody else, that inspectors can be stern or cold. Now, that isn't my experience of working alongside very many of you, but if we ever come across like that, then we can probably understand why. As I said, it's about the job, the important job that we do, and the inevitable power dynamics that that has. Now, where we are focused on the important job we have to do when we inspect and regulate, we shouldn't forget that we're dealing with people. Carrying out our work with integrity, being warm and friendly and professional, that's not mutually exclusive. We can do all of those things. We don't need to change the rigour of our evidence gathering or of our judgments, but we can always seek to improve the clarity and the openness of our communications. The next element I want to talk about is body language. Let's just do a little bit of reflection since you've been listening for a little while now. Are you mindful of your body language at this moment in time as you're listening? Nobody is perhaps watching you, but are you sitting with your arms folded? Are you bouncing your knee up and down? Are you tapping a finger? Are you looking out of the window? Are you looking at the clock? How often have you made contact with me, albeit through the screen today, versus having your head down writing some notes about what we've all been saying? All of those kinds of behaviours, either today or as they exhibit on inspection, from something as simple as I've just said as folding one's arms, tapping fingers on a desk, or looking at your watch, or, as we know, not looking up from a computer screen for a while when in a meeting, all of that can be perceived negatively by others, even when it's not intentional. It happens subconsciously. So while we're unlikely to focus on monitoring our body language during every single minute of every single day on inspection, just being aware of our mannerisms and how somebody else might pick up on them can be a really helpful starting point. As is taking the time to build relationships with those we inspect and regulate, and making clear that the expectations for our activities are as set out in our various handbooks. And when we build positive relationships with those we work, we're helping to set the tone from the start. We should never be afraid, and all of us have been serving practitioners of some kind in the past or currently, putting ourselves in the shoes of those who have been inspected. I've been inspected. I know what it's like to be on the other side of the desk. But that all helps us consider how they may be feeling and puts us in a better position to try and address anything that happens on inspection. So, for example, if you know it's highly likely that you spend a lot of time typing with your head down, then perhaps that's something you need to be upfront with leaders and staff about at the very earliest opportunity, acknowledging to everybody in a meeting that that's what you'll be doing, but you'll be consciously trying to lift your head and make eye contact as often as possible. It's just providing reassurance that if they do pick up on the fact that your head is down, that they don't then misinterpret that as not wanting to listen or engage with them as fully as they might be expecting. Other little things that I know we all do, but just as a reminder, body language can have a really positive effect. You know, welcoming people to a meeting, standing up out of our chair, offering a hand in terms of a handshake, having a smile, nodding reassuringly every now and then when listening, all goes a long way to putting people at ease. And now on to what we actually say. Now, obviously, it's really important, the words that we use and the language we use and where that comes from in terms of our evidence and the judgments and how that adheres to our frameworks. But sometimes we know our every word can be overly scrutinised and analysed by providers. Again, that's a human response. It's vital, therefore, that we convey our findings clearly so that providers understand how we've reached our judgments, and even more importantly, what it is they need to do to be even better. Now, this is particularly the case during our final feedback, but checking that staff have understood along the journey is just as important. We need to be able to carry out the task at hand, and so we can't overthink every phrase or term that we use, but we do need to be mindful about how our words can be perceived. I can remember on inspection, again, human interaction, innocently being asked, "Have you had a good day?" And obviously using words like good, evaluative words that we also use in our frameworks can sometimes give leaders the wrong impression, particularly if it's a difficult and challenging inspection. And while we wouldn't want to go into all of the strengths and weaknesses with absolutely everybody we meet in a setting, actually, we need to still engage with folk and be pleasant and polite and courteous, but just be conscious of how the words that we can use, perhaps just as we're walking out of the school or the setting, can have an influence on what they're thinking. So we need to be self-aware and we need to adapt our behaviour if we know, for example, that we have tendency to say too much. And then obviously the tone in which we say things. That can help us manage the message just as much. How we say something, even if it's positive, can be deemed less so or deemed worse than things might be. So let's just check that the important message we are sharing have been clearly understood. And again, that can be a very specific thing we do at the end of meetings or set periods of time. Now, I'm sure we've all had experiences of giving difficult messages on inspection. And that takes us back to the importance of establishing positive and respectful relationships. The way we set the tone at the beginning of a meeting, for example, as I've just alluded to, can really help put people at ease and help them perform at their best, like explaining things such as the agenda and the content of the meeting. Timings, how people can contribute, goes a long way to easing anxiety because we've outlined what's going to happen next. They can see beyond the next 10, 15, 20 minutes, and they know, importantly, how what it is they're saying or what it is they've been doing on all of the other days outside of inspection can contribute to the picture that we're gathering. It's about making people feel as comfortable as possible. So while it might be our 5th, 6th, 7th meeting of the day, for many people we meet on inspection, it will be their first and perhaps only meeting they have with us. So we need to be conscious of going through all of those steps for every single meeting that we have, because it could be the only opportunity that one individual has with us. And again, that is the only opportunity to set the right tone, the right body language, and put them at their ease. Because when people are at their ease, they can perform at their best and they can really showcase their setting to its absolute best. Next, I want to talk about that phrase we've used already quite a lot this morning, doing with, not to. It's been a mantra we've used for a long time in Ofsted, but perhaps it's not always the perception of those we inspect. So let's listen and act upon it. We want providers to feel that we've done inspection alongside them, not to them. And even when our judgments are challenging, the skill of colleagues, yourselves, in managing relationships and communication throughout most often means that even if leaders' views of their provision do not match our own, they are happy with the way that those are judgments, or they can see how those judgments have been arrived at. Everyone needs a positive inspection process, because what we do on the day will not only shape how those individuals perform during that inspection, but actually it will endure with them long after the inspection is finished. And it will shape their thoughts and perceptions for all of their inspections that are to come in their career. And of course, as we all do as human beings, they will go and tell others about their inspection experience too, which in itself can be a contributory factor to increased anxiety. And we know that everybody feels more positive about our work when we can involve them and be transparent in the process. The two go hand in hand. So involving leaders closely helps them to see what we see and understand the reasons for the evidence and the judgments that we're reaching. It also gives them the chance to question, to challenge and provide further evidence so that they know we are taking a rounded view of their provision. And it helps to build stronger relationships too, because the more that leaders see that we are willing to listen and willing to understand what it is that makes their setting, their provision unique, then actually the more that they will trust the evidence that we've gathered and the evaluations that we then reach, our findings. Now, again, as an inspector, I am acutely aware of the time pressures that are associated with inspection. And we're all used to managing those time pressures, whether it's regulatory or inspection activity. And it is incredibly challenging. But if we don't manage time well, then we can become even more stressed. And I'm talking about us as individuals now, as well as leaders who want to know what will be happening and when. So we need to be conscious that management of time can also add not only to our own stress, but those that are on the other side of the table. And that's not just about how we plan our activities. Thinking carefully about our own well-being can be as simple as remembering to stop and have a drink or something to eat. And I know that is a really tricky thing to do, because actually we are very conscientious. We want to ensure that we have gathered as much evidence as we can to ensure that the judgments we reach are valid and reliable. But we do need to take time to pause and reflect, really think through what we've seen, and actually take a moment to plan ahead for any challenging conversations that we do know we need to take or have, so that we can be clear and we can have a focus for the meeting, so that actually we can make sure that the words and the language we use is as clear as possible. And of course, in many of the cases, we're making time to save time further down the line. So if we need to take a bit longer to do something well, then we should. And this can save us time later and reduce the stress for all involved. Now, the next slide is one that essentially we've been covering without using the word through many of the others that I've shared this morning. It goes without saying, doesn't it? We need to listen to providers. And we do this. We do this. I've worked with lots of you, but sometimes we might not show this as much as we could. For example, when we are typing and looking down, as mentioned earlier, or when we're thinking about that great inspector skill of listening intently to what somebody's saying and how we're going to evaluate it and record it, while thinking of the next question that we might need to ask. We also need to remember to give people time to speak, to actively listen to what they're saying, and to provide time at the end of every discussion for them to add anything extra that perhaps we haven't asked about, but that they think is relevant. Again, shaping our meetings to ensure that even if this is the only meeting we have with one individual, they understand the parameters of the meeting and have every opportunity to put their best foot forward and showcase what it is that they do. Now, over the course of inspection or regulatory activity, that process, we do develop a clearer picture of what it is like to be a child or young person who attends. And leaders might feel we're listening less because we've narrowed, as the process continues, we've narrowed our focus over time. But it's important to continue to listen as the inspection progresses, because actually that helps leaders understand why we're doing what we're doing. Are we confident that some things now are a certain way, and therefore we're redirecting our attention to gather evidence in other places? And we need to think about how we can use our team meetings to reflect what we have found out from talking to leaders, to show we have understood their provision. We've understood what makes their day-to-day work tick. And we've really listened to what they've told us throughout the entire process, from the initial notification until that very final feedback meeting. So I'm coming nearly to the end of my slides, and just before I hand over to Yvette, I just want to kind of reflect on, so what do we need to do next? What is our reflection, and what do we need to improve further? Now, Martyn gave you some details there about short, medium, and the long term, but where do we go from here? Well, as you know, already been mentioned, we've made a number of changes, particularly over the last year or so, to our various handbooks. We've tried to ensure clarity so that anybody, whether that's an inspector or a leader, can pick up our framework and understand the broad principles in which we will work. We also need to think about our judgments, and also we've reviewed our complaints process. And I'm committed as National Director for Education to think through what it is we need to change, what it is we might need further training on, what it is that we would all appreciate more of in terms of doing the absolute best job we can as inspectors. And of course, that might be tied into the big listen. But of course, our day-to-day activities, inspectors, both centrally and out in regions, is about sharing, yes, what we are good at, but also what we might need to do a little bit more in terms of excellent inspection practice. And today is part of the process. As Martyn said, it's not the beginning and it's not the end. It is just part of our training offer in terms of wanting to be the best we possibly can be. So today is by no means the end. There is certainly more to come over this term. We have a planned programme of development that includes providing opportunities for us to reflect on what we've learned and the impact on our practice. And of course, all remits will have a national conference this term. I know social care have their conference this week, but early years, schools, further education and skills, that is all later in the spring. And those will inevitably build upon our own learning and the changes we need to make to both what we do, and as we've emphasised this morning, how we do it. And as an organisation, we will continually reflect on our practice. That's going to be my job. That's my commitment to you and the sectors we inspect in terms of education as National Director, to seek, engage and action the different ways in which we can all improve what we do, because we're all one part of a bigger system and we play very different and unique roles within that, but we should never forget that we are of the system and it's by the system. So thank you for listening to me this morning about education in particular, although I have covered elements that will go across any type of work that we do. And I'm now going to hand over to Yvette Stanley, who's our National Director for Regulation and Social Care.
Thank you, Lee, and thank you, colleagues. I'd also like to wish you a happy new year, and I hope some of you had a rest and reflect for Christmas. But I'd also like to thank all of the colleagues who were on duty over Christmas. We know that for our most vulnerable children, when schools are closed, it is actually their least safe time. And having had a bit of leave myself, coming back to see the notifications that early years and social care have been receiving, I really would like to thank you for dealing with that very difficult and challenging work while the rest of us were having a little bit of relaxation. So thank you. And like Martin, I came to Ofsted with 30 years experience being inspected in the various sectors, and indeed the only inspections that I haven't been on the receiving end are our prison inspections and indie schools. So perhaps that's something I need to do in my next career, run a prison or run an independent school. As Lee said, his words touch on all our remits. Of course, our ambits are different, the rules are different. We're the regulator, so we have an enduring relationship in early years with childcare providers and in social care with all of the different settings from adoption and fostering to secure children's homes. So there are differences, but what I would say is that the culture, the behaviours, the values should be the thing like a stick of Brighton rock that join us all together. Across all our sectors, we know that providers are the first improvers of our services, those services for children and for adults when we're talking about prisons and apprenticeships and so forth. But we do this, don't we, with exactly the same values and exactly the same expectations of ourselves as we have of providers. And while looking at Lee, you'll be thinking that we've reflected and made changes to the education inspection framework inspections first. We have also been working together. We are one team, Martin, Matthew, Lee, myself, the regional directors and wider EB, looking at the implications across. And as I said, our ambits, the regulations will be different, but we will make sure that the adjustments we make sense, are proportionate and reflect the expectations of us for each of our remits. And across all of our remits, as Martin made clear in his introduction, children and young people are at the heart of what we do and why we do it. It's why I've got out of bed for the last 30 years each day to make a difference for children. In social care in early years particularly, we're often in situations where we're working in settings with vulnerable children, including in actual children's homes, the places children live and the places where childminders live. We do difficult regulatory work sitting on the sofa, one-to-one with a childminder. We may be visiting a childminder because of mental health concerns, and we might be talking about whether they can continue to practice as a childminder. We may be in a children's home because a child has sadly died. These might be children who are at high risk of suicide and the home has done absolutely everything they could have possibly done. And we are there post that sad and untimely death, talking about how they can, their reflections and how they can improve their systems. This is difficult and delicate work, and I know you do it with absolute great care. We might be in a childminder talking about the fact that we've had a recent DBS on their partner or their child, and that might prejudice their ability to continue to be a childminder. Again, really delicate and careful work. And we expect you and we see you do that work with exactly the same value set that we expect providers to create in their environment where they're caring for and protecting children. So we put children first, but we are respectful with providers, and we act with care and concern for the providers with whom we're discussing these very difficult things. I'm also conscious that particularly in the early years space, but also in children's homes, you can be working on your own, indeed, maybe most often working on your own, and don't have the opportunity of another colleague actually alongside you. So the work that we're doing to make sure that you've got the support through duty so that you can have that conversation, which I know many of you already had, but we're making sure that that's really systematic across all our remits. So whilst this might be a greater part of our day job in the regulatory space, like all our colleagues across Ofsted, we're constantly looking at how we can improve and undertake our work, whilst maintaining that important rigour and integrity required to ensure that children are made safer, are appropriately cared for, and that their lives are improved as a result of the provision therein. And whilst children's best interests will and should always prevail, we are ever conscious of the impact of our findings on providers and individuals. We have every confidence that you manage these difficult situations well, but we want to continue to work to make sure that you feel safe and supported in your decision making, have the skills, repertoire and confidence to manage these difficult conversations really, really well. And every day, those regulatory decisions are a careful balance, aren't they, of the needs and risks to children, and making sure that the provider understands and can take the action, and that provider has the support around them, that children's home manager, that childminder, the providers in Lee's remit have the support around them to make the changes to make a difference for children. So you'll be aware that providers now have the opportunity to contact a manager via the duty line, or in the case of the DCS, has always been the case, to speak to the quality assurance manager, normally a senior HMI linked with the inspection. We've had relatively few calls to late, but we are listening carefully to all the feedback we've received, and we'll use this to build our future plans. And it'll be important that we share that learning across all remits. So Martin, Lee, Matthew Coffey and I, and again, the broader EB, will continue to work together as a team, taking your feedback as well as that of providers and sector reps through the big listen and through constant reflection and our continuous improvement journey going forward. There'll be regular updates. And Martin was really clear, and Lee was too, we will continue to reflect with staff to make sure that the improvements we make support you and enable you to do the work in an environment which means that providers also feel supported in making those improvements that they need to make out there. So I'm going to hand over now to Lucia, who's going to take us into the break. And I would say, and I'm sure she will, make sure you take the break. You've had a lot of listening this morning, and it's really important, as Lee says, that you reflect on, have I had a drink? Have I had a little wriggle? Have I got the space to think about these difficult issues and ensure that I can do each and every day the inspection and regulatory work to my very best efforts. Thank you, Lucia.
Thank you very much, Yvette, and I couldn't have put it better myself. And thank you to all of our speakers so far, Sir Martyn, Lee and Yvette. We're now going to take a 15-minute break. I'm going to ask you not to leave the call because the tech requires you to stay logged in. So please just leave it as is. Make sure you get yourself a drink and a stretch. And we're going to start again at 10:56. So 10:56 we'll start again. And after the break, we're going to hear from the Chief Executive of Mental Health First Aid England, Simon Blake. Thank you. Welcome back, everybody. I hope you managed to get a drink and a stretch. And I'm really delighted that in this next session, we're going to hear from Simon Blake. Simon is the Chief Executive of Mental Health First Aid England, and we are really pleased to be working with Simon and his team in the rollout of the mental health awareness training for all inspectors. And this is going to be a 4-hour virtual learning session with small groups of inspectors. and the first cohorts start this afternoon, and the programme will run until the end of March. And if you are a lead schools or lead FES inspector, we're asking you to complete this learning by the 19th of January. And you may already be booked on, and if not, details will be sent to you soon. So Simon, we are really delighted to be working with you and your team, and I'll hand over to you.
Thank you very much, Lucia, and it's a real pleasure to be here with you today. Thank you for the opportunity to speak with you at this training webinar, which is the next phase of an important conversation about Ofsted inspections and mental health, and about supporting the well-being and mental health of the workforce and yourselves through the inspection process. Like many important conversations about system, culture and cultural change, its origins stem from a tragic situation, and in this case, as we know, the suicide of a head teacher, Ruth Perry, a year ago today, in which the coroner, Heidi Connor, ruled that the Ofsted inspection contributed to her suicide. And my thoughts are with all those who knew and loved Ruth, especially today. And it's important, of course, that we do all we can to avoid this happening again. And this training webinar is an important start. When I read the coroner's report, she was clear that it was really important that we look beyond individuals and focus on the systems, the policies and the training. And I think it's really, really important to emphasize that at the start of this. And I was really pleased, therefore, that Sir Martyn, Lee and Yvette really talked about this as being the next stage of the conversation, and that the mental health awareness training, which I'm going to introduce you to today, is part of a much bigger piece of work to address, in Sir Martyn's words, the root causes of some of the challenges within inspection processes, and importantly, recognising the realities of those working in schools and other settings, and the importance of being very human, and also the realities that you face when you are undertaking those inspections. I was also really pleased to hear Sir Martyn commit to openness and transparency, to conversations from all of the previous speakers about continuous learning, improvement, sharing, building on the expertise that you have. And I know that the unions welcomed their initial conversations last week. And then I'm also really pleased to have been invited to be part of a wellbeing reference group, which gives all of us the confidence that this is part of an ongoing conversation where we will continue to explore the issues and make sure that this initial training session is part of the much wider context of system change and improvement. So I just want to be really clear that our starting points for this conversation will be different. Some of you will already have done lots of thinking and training on mental health, including perhaps some mental health first aid training. Some of you may hold mental health qualifications, and others of you will have done little or no training and perhaps little or no thinking. We will also have our own lived experiences. And when we talk about mental health, people often think about mental illness rather than mental health, and about other people rather than ourselves. But this is about all of us. And Natasha Devon, who's a journalist, a writer, a former government advisor on mental health, always says, whilst 1 in 4 of us may experience mental illness in our lifetimes, 4 in 4 of us have a brain, and we all therefore have mental health. And I think that's something which we really, really need to think about as we embark on the next stage of this work. Now, if we were in a real room together this morning, or indeed a virtual room where we could see each other, and I asked you to put your hands up if you've been affected by or know someone affected by poor mental health and or suicide, I can guarantee there would be a sea of hands. And whilst we undoubtedly still have an enormously long way to go, that sea of hands reflects the significant progress that we have made in understanding about mental health and understanding about stigma and overcoming mental health stigma. But as I said, there is still an enormously long way to go. And it's the combination of our personal and professional experiences that will have shaped our knowledge, our understanding, our thoughts and our feelings about mental health and suicide to today, and will affect how we show up to this conversation and to the training in the weeks ahead, as well as how we will how it will help us to work to understand what else can be done as part of improving the system more widely. So I just wanted to say a little bit about me. Immediately prior to joining Mental Health First Aid England, I was Chief Executive of the National Union of Students. But for over 20 years prior to that, I worked in a range of organisations, including the National Children's Bureau, where I led the Personal Social Health and Citizenship Programme and undertook the feasibility study for the PSHE Association, which has now been around for probably close to 20 years. And I was also very closely involved in health and wellbeing programmes for children and young people in public care, youth services, colleges, as well as youth justice. I was an assessor for the National Healthy Schools Standard when it was launched in 1999 and was then seconded into the Department of Health to work with Department for Children, Schools and Families on the National Healthy Schools Programme and Children's Public Health. I've worked in and with schools and services up and down the country, as well as with Ofsted inspectors over the last couple of decades. And I've got a broad understanding, therefore, of the context we're discussing, and know that people, those being inspected and those inspecting, and often, of course, you're the same people at different times, are working hard in often challenging circumstances. And one of the things that I was reflecting in preparing for this talk was how so often little changes that happen on a day-to-day basis mean we don't recognise quite how far things have changed and what's happened, and how lots of little choices and decisions might affect some things dramatically. And I think that is the same in education, in social care, in inspection processes. So having that opportunity to really stop, to pause, and to reflect and to think about how can we make the system as good as we can is really, really important. I've also obviously learned an enormous amount about mental health and wellbeing, about my own mental health and wellbeing, and self-care, self-compassion, working with others and supporting others during my time at Mental Health First Aid England. And so the combination of those different experiences brings me to this conversation with curiosity, empathy, care and compassion. And I hope that you are also coming with that. And whilst we all bring different experiences, different perspectives, I'm sure, as has been said before, that you are here because you believe that inspection done well is important and contributes to the safety, well-being and attainment of children, and is important for teachers, senior leaders and communities. And by bringing those combined experiences together, we can, of course, start to create the change. So I would just ask you, and this may be me reflecting on me and how I know it can be with virtual learning, is please be as fully present as you possibly can. Please don't be trying to multitask. Really engage with the content and the issues, both today in this initial training and in the detailed training that will follow. Please do reflect honestly and carefully. Think about the experiences of your inspections from different perspectives. Yeah, whether you are when you've been inspected, when you're doing the inspection, and really pay attention to the thoughts and the feelings, because our own self-awareness will do at least 3 things. It will help us to manage our own feelings and look after it will help you to manage your feelings and look after yourself as an inspector, and to know when you may need to ask for help. It will help you to be an inspector who can spot signs of distress prior to, during and after inspections, and to develop confidence to try to eradicate that stress where it's possible to do so, and also to manage those situations effectively. And it will also help you to create the overall positive change that Sir Martyn and the team are seeking to create. And of course, that goes without saying that it's important that you look after yourselves both today and in the training in the weeks ahead, because we all bring ourselves into this. So please do seek help and support if you need it. On this slide, we've got some sources of help and support, and that will be available as part of the deck that's circulated with this pack. So a little bit about MHFA England. Our vision is to improve the mental health of the nation. At Mental Health First Aid England, we're a social enterprise. We've been around for over 15 years. We first came through government programmes, so the National Institute for Mental Health in England. And over that time, we've worked with over 20,000 workplaces. And we've worked across different sectors. And what we found all of the time is that training and awareness is a really important part, but it's a whole system approach that creates mentally healthy processes and cultures. As a social enterprise, we provide mental health and mental health first aid training and consultancy to workplaces from the very big to the very little. And I know that you are all working in different settings. Some of you will be working in big schools and some of you in those one-to-one settings with childminders. And we've worked from the very big to the very little across the public, the private, the voluntary and the social enterprise sectors. And each and every time it is about looking at those whole systems, about the whole approach, the whole context, where we really do create that change. Under an initiative funded by Theresa May, when she was Prime Minister, we provided training to a significant numbers of schools. And again, the evaluation of that training shows it makes the biggest difference when people are operating in a culture that is open and supportive. Now, thankfully, over the last 20 years or so, we've seen some real cultural shifts in understanding about mental health. There have been some dramatic shifts also, of course, in our digital habits, which have created an always-on culture, both within and outside of work. And Deloitte, in their research, indicate that that's a significant contributor to an increase in poor mental health. And I think it's really important to recognise that when we think about the work that we're doing here with schools and across different settings, because that change will also impact on the lives of the children's workforce and all of us in our roles, and provides part of the backdrop in which we're having these conversations. So in the coroner's finding, the senior coroner, Heidi Connor, reported that it was the first Ofsted inspection of Caversham Primary School for 13 years. She raised a significant number of issues about the systems, policies and processes, which the training that MHFA England is not providing is not going to be able to address. And it's really important that Ofsted, the Department for Education, Reading Council consider carefully those recommendations and respond to them. And as Sir Martyn said, that's expected to happen on the 19th of January. So I look forward to supporting colleagues as we consider those wider systemic issues. But the coroner also stated that a non-favourable inspection outcome would be distressing to any head teacher. And she also noted that whilst the outcome of the inspection was part of Ruth's distress, it was not the only cause. It was about the way the inspection was conducted in a manner which in parts lacked fairness, respect and sensitivity. And that's where we've got a real opportunity as individuals, as part of the training, to think about how do we bring all of that knowledge and understanding to think about how we can improve that fairness, improve that sense of respect and sensitivity, and ensure that people feel worked with, not done to, as people have said as before. I think it's also really important to emphasise that we know that this isn't an always easy job, that giving feedback may be difficult, and giving feedback that may be difficult to hear is an important part of being an inspector. Dealing with difficult circumstances and situations is an important part of this role. But as a very dear friend of mine who's a deputy head said, it isn't what is done, it's the way it's done that makes all the difference in how you hear and receive the feedback and its impact on you. And so we know that for inspections to be robust, trusted, and to be perceived as fair, there has to be psychologically for everybody involved, including yourselves. The realities and the pressures facing the caring professions and schools, as well as inspectors, requires us through this training process to be honest, reflective, and importantly, be willing to be uncomfortable and to challenge ourselves and each other and the system so that we can create the improvements that I'm sure that we all want to see. Now, I'll come back to psychological safety a bit later, but first, I just want to talk about some facts about mental health. So 1 in 6 workers will experience depression, anxiety or stress related issues at any one time across all industries. We've been and are living through extraordinary times which cause disruption, distress, additional work and trauma in people's professional and personal lives, where stress is a natural response. And the Centre for Mental Health estimates that 10 million more people will need additional support for their mental health as a result of COVID. In 2021, the cost of poor mental health to UK employers alone was estimated at 56 billion. And in 22-23, 875,000 workers said that they experienced work-related stress, depression or anxiety. In the same year, depression, stress, anxiety accounted for almost 50% of all work-related ill health and over 50% of all working days lost due to work-related ill health. So stress, depression, anxiety, the impact of mental health on work across all sectors is really, really significant. And that's an important part of the context that we're working in. Some facts about suicide. There were 5,642 suicides in England and Wales in 2022, which means that more than 17 people per day die by suicide. Between 10 and 25 times that number of people attempt suicide. And in Great Britain, just as context for that, 1,695 people died in road traffic accidents in 2022. So just to give you some sense, about the scale of the issue that we're really facing here. And then 76% of people who die by suicide are men and 24% are women. And then people who identify as LGBT+ are more likely than those who identify as heterosexual to display suicide behaviours. So bringing this closer to home, in 2019, Ofsted did research into teacher wellbeing because the UK Health and Safety Executive identified that teachers and education professionals reported the highest rates of work-related stress, depression and anxiety in Britain. And whilst the report showed that teachers love working with children and young people in the classroom, it also showed that high workload, work-life balance and a perceived lack of resources were already impacting on teacher wellbeing before the pandemic. The report, as we've said before, said teachers often feel done to rather than worked with, and as a profession often feel undervalued, and that Ofsted inspections can be a cause of stress. A commitment was made in that report to reduce this burden, and this is an important part of driving forward that commitment. The 2023 Teacher Wellbeing Index further underlines those findings, and using the Warwick Edinburgh Mental Wellbeing Scale, which is recognised as a valuable and reliable measure of wellbeing, teachers scored 43.65, and scores between 41 and 45 reflect a high risk of psychological distress and a risk of depression. Some other striking stats in that index: 89% of school leaders report being stressed, 9 out of 10. 81% is reported experiencing symptoms of poor mental health owing to work, so 8 out of 10. And 39 had experienced a mental health issue in the past academic year. And 40% of school leaders thought their symptoms could be signs of burnout. And 71% thought that the inspection process negatively impacts on mental health and well-being. Now, none of that is easy to hear, but it is really important context. And similarly, the Care Quality Commission report into the state of health and social care in 2020-2021 identified that health and social care professionals feel stretched and at risk of poor mental well-being, and all sorts of stats that reflect those similar trends. And all of that was prior to COVID, evidence showing that professionals working in education and social care were feeling stretched with limited capacity and resources. We know that's been exacerbated by COVID. And of course, whilst we all talk about COVID and the pandemic, there are also a whole range of other issues which are impacting, such as the rising living costs, such as domestic and global events. And they all set the context and the backdrop in which you are going to inspect schools and services. And that backdrop affects every single person in one way or another, including ourselves. Now, we know that the impact of stress is cumulative. Many of you will already know about the stress container, and if you don't, then that is something that you will learn in the further training that you will take part in the weeks ahead. So stress is cumulative, and if you think about what that means, there are a whole range of times in our lives when we have probably dealt through the course of a week or a month or a year of a range of situations which were incredibly difficult. And then something really silly happens. We snap at a partner. They ask us a question and we respond in a way which is out of proportion to the question that's asked. I did it myself to Dad over Christmas, or we cry when we stub a toe or when we drop a plate. It's not that particular question. It's not that particular stub of the toe or dropping of the plate. It's the cumulative impact of stress, the rest of the things that we have been dealing with. So if we then think about what the evidence is telling us about the mental health of well-being in the staff in the settings that you are going in to inspect, often on your own, sometimes as part of a team, many of the staff and the senior leaders are already experiencing the negative impacts of stress and anxiety or signs of burnout without the impact of inspection. And that knowledge is really, really important because it has to affect the way that we then address and go through the process that we're going through. For those people who are going through an inspection, the experience of being told they're going to have to go through to receive the inspection judgment and report will be very different when they feel they can approach that with resilience, clarity, and feel like they're able to manage well with the outcomes of it, than with somebody who may be experiencing poor mental health. And of course, the thing which we know really, really, really clearly is that we cannot tell whether people are experiencing poor mental health simply by looking at them. But we can and we will learn to spot the signs, and that is why we must use every ounce of experience, empathy, compassion, and emotional intelligence that we have throughout the inspection processes to create psychological safety that will support everybody involved. Now, we will all have heaps of personal and professional experiences of situations that have worried us or been stressful. It may be a job interview, it may be an inspection, it may be getting results from a health check. Almost all of you will have experience of being inspected in the past. We've heard today already some people close to 100. Some of you will be concurrently working as an inspector and in roles where your schools and services are being inspected. And psychological safety relies on human connection. It requires trust, open communication, learning, and collaboration. And you know as inspectors that the process can be fast-paced and feel relentless for you. So that job of creating psychological safety is really, really important. You're giving short notice on inspection and you have a short amount of time on site with a lot that needs to happen during that time. And it might be against very difficult circumstances, as Yvette outlined earlier today. So it's inevitably challenging sometimes to get through everything that needs to be got through as part of that inspection, whilst building relationships and rapport quickly with people you probably will not know, or will not know, certainly in that context. And as was mentioned before, where there will also be power dynamics. Now, I'm a non-executive director of an NHS Foundation Trust. And even when time is short, which it often is when we're going to visit services, try my best to create rapport based on a sense of respect for the different roles and expertise we have. And I'm sure that you will do the same. Whether a NED or an inspector, however we see ourselves, and I will often look in the mirror and see a 7-year-old boy from Cornwall, but people will see me as a NED or as the Chief Exec of Mental Health First Aid England or the Chair of Support After Suicide Partnership. Whatever it is, people will have perceptions about us based on our role and what they know about us, and of course will have done some research and what they expect us to do. So thinking about how to build relationships and create rapport through careful introductions and a collaborative approach where everybody feels listened to and their voices heard will doubtlessly have positive benefit for those being inspected, the pupil or service users, and yourselves. People working in schools and services are focused on delivering quality provision for their children and young people. As all of you know, these are vocations that we are passionate about and that we want to do and to demonstrate are doing a good job. And so as human beings, it's a very natural response to get worried about situations, particularly where there is a lack of pre-existing relationship, where there are different perceptions and experiences, and ultimately where there will be a judgment made, which may include difficult feedback. And it's really important that we recognise that this isn't an either or, this is about trying to do this important task, which will include difficult feedback in a way which supports the mental health and well-being of everybody involved. We know that clear communication, positive feedback throughout will help to build that confidence, trust and safety. So, as has been mentioned already, the warmth and clarity of communication, the time taken to explain expectations using collaborative approaches which demonstrate care, curiosity, fairness and sensitivity will all help to increase confidence and safety, and to manage how we handle and respond to situations which people may find stressful. And as has been said many times before, this isn't the start of the conversation. There is already a code of conduct which requires inspectors to carry out work with integrity, treating all those they meet with courtesy, respect and sensitivity. And there's guidance around well-being. So there's work that's been done, there's conversations that's being had, there's experience which you bring into this next stage of work. So I just want to talk to you now a little bit about the mental health training sessions which you are going to take part in. So following this initial training webinar, which is introducing some of the issues and trying to connect to the experience which you already have, over the next few weeks, all of you will take part in a 4-hour awareness course in mental health delivered by my organisation, Mental Health First Aid England, and the remainder will receive that training by the end of March. The training is focused on developing your awareness around mental health. It will not mean that you're a mental health first aider, a psychologist, a counsellor, or an expert in mental health and suicide prevention outside that expertise, which you've already got. And of course, many of you will have all sorts of different roles. It will, however, help you to recognise signs of distress and anxiety in others and enable you to reflect upon your own mental health and how to maintain positive well-being, as well as perhaps pique your own interest in doing some further development of your own, whether that's mental health first aid training, suicide first aid training, or other training around well-being, mental health. By the end of the 4-hour training session, you will be able to define mental health and some mental health issues, understand factors that affect mental health, identify the stigma and discrimination surrounding mental health issues, feel more confident about starting mental health conversations as an inspector, and understand how to look after your own mental health. And I guess the really important bit about this is it's about how do you use your expertise and really think about, what does this mean for me? What does this mean for the people I'm working with? What does it mean for the process I'm going through? What does it mean for me in the way I am and how people experience me? What does it mean for the people I'm working with when I am part of an inspection team? And what will it mean for the senior leaders and the wider community? And I guess if you take nothing else from this initial piece of the training, I hope you then believe and am confident that you will take more from the deeper training. Is please remember this, that you know the inspection process is inside out. In this virtual room, we have decades, probably centuries of experience between us, which we bring to the table. We are not starting from scratch, and we need to really make sure that we bring all of that to really try to create that change moving forward. So as you're going through the mental health training course, you will learn about the mental health continuum, about what mental health means, about mental illness, about keeping well, and about protective and risking factors. And I've just asked you again to think, what does that mean for me in my role as an inspector? What does that mean for the different types of services and the schools that you inspect? What might different people that you've met in your role have experienced? What does that tell? How can you bring that learning to life? How can you really draw your real life experience to this and apply it to think about how you can immediately be starting to think about changes that you might want to make as you move forward that are within your gift to do so? It goes without saying, I guess, but information about mental health alone is not going to change behaviours and experiences, and all of us are different. The benefits of the training we felt most keenly and make a difference in practice if you use your experience and think about taking that learning into the context and have discussions with other people on the training who'll be working in different contexts and see how you can pull that knowledge and understanding. You'll also think about the concept of the stress container, which you talked about briefly earlier today. Use it as an opportunity to reflect on your own stress container. Try to put yourself in different people's shoes in the context of inspection. What would it mean for me if I was in a different role? What does it mean for me in my role? How will people experience me? How would I experience me if I was in a different role throughout this process? And what does it mean for the people I'm working with when I'm part of an inspection team? What will it mean for the senior leaders and the wider community? And how can I use those different experiences to think about what I can do differently next time? There is no one way of doing this. This is all about using your experience, using the knowledge and understanding and bringing that together, because the way that you will do it in a small rural primary school or in a childminding setting or in a public care setting or in a big academy trust that's part of a chain will need to be different. So how can you use that experience to really apply the best of our different knowledge and understanding? When you're encouraged to think about the signs of distress, the opportunity here is really to reflect on different responses that senior leaders and others have had to conversations, to judgments, and to feedback, and to really think about when someone is in distress for whatever reason, whether you understand their distress or not, or understand the causes of it. How do we want to be as one human being to another in that process? How, as Lee talked about and Yvette and Martyn talked about, can we display empathy and demonstrate that we care? You will learn about thinking distortions and how to challenge them. And we know that people will come into any and all inspection processes with all sorts of preconceptions, concerns and experiences, either their own or from things they've heard from colleagues and others in cluster groups and beyond. And when you do this training, I'd really encourage you to think hard about how in your deeds and words, in your different roles, pre-inspection, during inspection, and after the inspection, you can use your knowledge about the process, the inspection framework, and your empathy and understanding to reassure leaders and demonstrate that you value their expertise and understand the context they're working in, the challenges they're facing, and help to challenge some of the thoughts that they might have about inspection so that it really does become and be a valuable process. And in the final segment of that 4-hour training session, which I promise you will go really, really quickly, there will be a focus on how to have good quality conversations. And that will include having difficult or important conversations with care and empathy. And again, I think it's really important to think about communication, this specific role as an inspector. Now, when it comes to communication, it's often easy to think about those formal communication points. But we also know that there are a whole range of communication points throughout the 2 days, whether you're inspecting as part of a team or whenever, 2 days, if it's 2-day inspection or if it's shorter. Throughout that process, we've got opportunities and people are experiencing our communication, as was said earlier, through body language or other. But we know that celebrating success is a really important part of supporting mental health and well-being. So when thinking about quality conversations, and thinking about the quality of conversations which may be difficult, I encourage you to think about how throughout the duration of the inspection, you can help create the best conditions for people to be able to hear the feedback at the end of the inspection. How can you provide positive feedback about the best practice, the great practice that you're seeing throughout the inspection, even if you're asking questions for further information or things that you want to know more about? How can you make sure that that tone is set as you're going through the process, so it creates those conditions so people can hear the final judgments and the feedback that is presented? You know there's only a short time to prepare to give the feedback at the end of the inspection. That is the reality that you are currently working in. That is the reality that we need to be thinking about those difficult conversations and about how we can create the conditions. So how can you think about yourself within that process? How can you make sure that you've taken a breath to manage any feelings that you have, and so that you can take the time and care to get that communication right? How can you give yourself and your team, where you have one, enough time to think about how you are going to say what you believe needs to be said? We know the how is as important as the what. How can you think about what you'll see, about how you ensure the verbal and the non-verbal responses that you are seeing and hearing, and any questions that those being inspected may have about your feedback or judgment can be responded to with openness, respect and care throughout the process. There is a lot to think about, and I'm conscious that today there has been a lot of transmit. It has been a lot of one-way transmission to you. Through the training, the next stage of the training, you will have the opportunity to talk, to converse. You can do that informally following this through the networks, the groups, the clusters that you operate in. And that conversation, that thinking, that reflection is really, really important, that goes way beyond the 4-hour training process. So I just want to end by saying this. Whatever our roles and our responsibilities, our professional disciplines, our lived experiences, we can all agree that we want great services, great schools, and great outcomes for children and young people. And we want inspections to contribute to those outcomes in a way that is and feels fair, consistent, and considerate. It's really important, I think, to remember it's not one person that can do this. It's not one big thing, and there is no silver bullet which will achieve the outcomes and the change and the improvements that we want. It will be the combination of your different experiences, of the multiple different small actions that will help to create that systemic and policy and behavioural change in the context of those inspection processes. And together we can work to create that. I'd like us to just think about and imagine a world where everyone feels like equal partners in a deeply collaborative human inspection process, which is and feels fair, is and feels robust, and ultimately improves outcomes for children and their families. That is the reality that we can start building together. And I and all of us at MHFA England look forward to working with Ofsted, partners, and all of you to do all we can to support you to realise that shared ambition. Thank you very much.
Thank you very much, Simon, for that really insightful and very thought-provoking presentation. I know that it will have given all of us something to reflect on as we prepare for that mental health awareness training ahead. Just by way of information, there are already 500 colleagues signed up for the Mental Health First Aid England training this week. And lead schools and lead FES inspectors, we're asking you to complete the training by the 19th of January in order to be able to inspect after that. If you're not already signed up, then your regional support team will be reaching out to you very shortly to help you sign up. And all other inspectors, we're asking you to complete that training by the 31st of March. And again, you'll either hear from your regional support team or our inspector training team with information on how to sign up. And now our final speaker today is Andrew Cook. Andrew is our Deputy Chief Operating Officer for Delivery, our Regional Director for the West Midlands, and he's also our Senior Wellbeing Champion. So Andrew, I will hand over to you. Thank you.
Thank you very much, Lucia, and thank you, Simon. That was an excellent start. to what is going to be quite a lot of training around our mental health. I suppose I'm talking to you today really as Ofsted's wellbeing champion, the senior member of staff in the organisation that works very hard to promote good mental health and wellbeing for all of Ofsted's staff. But I also speak to you as a mental health first aider. I was trained as a mental first health aider by MHFA England some time ago. And I just want to talk briefly a little bit about that, to tell you a little bit about the journey that we've been on. And then I'm going to echo probably much of what has been said today to remind ourselves that we need to look after ourselves as we look after each other and those that we work with. So back in 2017, Ofsted launched training for mental health first aiders. And like I said, I was very pleased to be one of the first 16 who attended that training. I'd introduced the concept of mental health first aiders to senior leaders in Ofsted around October 2016, and then worked collaboratively alongside colleagues to get us to a point where we could start training our first cohort. My passion to make this happen was based on my own experience of trying to support someone whose mental health had deteriorated to the extent that they were very unwell. I felt I had done everything I could to understand, but I had much to learn about supporting others. It was also important to recognise how my own mental health was impacted throughout this difficult time. What my mental health first aid training did for me was to help me focus on the signs of anxiety, stress, and mental unwellness, and how better to respond. And I hope that through this training that we will all learn more about that. Although I am a mental health first aider, I know that this does not make me a medical expert. It's important that we know when to signpost people to the professional help they may need. We now have over 70 mental health first aiders in the organisation, and I'm proud to be Ofsted's wellbeing champion. While there is more work to do, I believe Ofsted has become better about being honest about mental health. May I take this opportunity to thank you for your work as an Ofsted inspector. Regulation and inspection activity, as we've been told, can be very intense due to the time restraints and the responsibility of getting judgments right for children. When you need support with your regulation and inspection work, please make sure you ask. Someone in Ofsted will be there to help. When we work as inspectors, our own mental health and well-being is important. Emotional and mental health is a vital part of our life and affects how we think, feel, act, make choices, and relate to others. It impacts on how we adapt to changes in life and cope with adversity. We all experience stress. When we experience stress or anxiety, it can lead to the feeling of being under too much mental or emotional pressure. Simon has already mentioned stress containers, and this will be part of the training that follows. And I urge you again to think about your stress container and the importance of managing this effectively. With good mental health, we can think positively, feel confident, and act calmly. With poor mental health, we might find the way we are thinking, feeling, or acting difficult to cope with. May I encourage you to make sure you take care of yourself. For example, we know that getting enough sleep, what we eat, physical exercise, and connecting with people around us can all help to support our well-being. It's also important to talk to others about our mental health. Why not take this session as an opportunity to start a conversation with someone about your mental health and be honest about how you feel? We know that those working in the providers we inspect and regulate are also doing all they can to improve children's lives. They face a range of significant challenges, and through regulation and inspection, we find many inspiring accounts of children's lives being positively impacted by the care and education they receive. Simon has just told us that 1 in 6 workers report experiencing a common mental health problem like anxiety or depression in any given week in England. A useful definition of work-related stress is provided by the Health and Safety Executive as the adverse reaction people have to excessive pressures or other types of demand placed on them at work. We must appreciate that regulation and inspection contribute to the pressures that sector colleagues experience. I've been a head teacher, and I know how much I wanted the inspection of the schools I worked in to go well. It was extra pressure I wanted everyone to be able to achieve. When we regulate and inspect, we need to be acutely aware of the impact of our work on others. We need to quickly form those positive relationships with sector colleagues and to appreciate the challenges and pressures that they are experiencing. In doing so, we must be very aware of how we come across and how we are being received. Lee reminded us earlier that we can regulate and inspect with integrity, but still ensure that we come across as warm and friendly. We do so by being supportive, considerate, and compassionate. I hope that today's session has made you think again about how you will do this when you carry out work for Ofsted. And finally, we thought earlier about the roadmap of learning about mental health that will take place over the next few months. Many of you will have already had similar training, which has given you confidence in understanding and responding to mental health concerns. And of course, as well as training, we all bring our unique experiences of life, which themselves teach us so much about ourselves and how we can support others. Today's session and the training that we will take place over the coming months reflects the importance that Ofsted is giving to mental health and well-being. We are building on what we already know so that we can be more aware and responsive as we inspect and regulate. There is a lot more that we need to do, and we're going to do it. And as you journey with us, let's look after ourselves and those that we work with. Thank you for listening. I'm going to pass back to Lucia.
Thanks very much, Andrew, and thanks to all of our speakers today. And most of all, thank you to you for watching and listening. We hope that you found it useful and that you're looking forward to the training to come. Just a little bit of logistics at the end. Finally, a reminder to save your questions for those regional reflection sessions that will be coming up in the next few weeks. And on technology, we're conscious that there are some colleagues who weren't able to join today because of technical issues. So we're working hard to make sure that the recording of today's webinar is available as soon as possible. If you have attended this webinar live, then a form will be sent to you to enable you to record your attendance. And if you're watching it as a recording through LearnSpace, LearnSpace will automatically record your attendance for you. We'd prefer you to watch it through LearnSpace, but if bandwidth makes that challenging, do remember that the webinar will be made available on Ofsted's YouTube channel as soon as possible after the end of this webinar, and a link will be sent to all inspectors with information on how to record that you watched it on YouTube. Thank you very much for joining us today on behalf of all of us, and we're really looking forward to working with you on this journey. Thank you and goodbye.